In today's video, we're going to talk about the importance of vaccinating your cat. Cats don't actually have 9 lives, so you need to do what you can to protect them. Several serious feline-specific diseases afflict many cats every year. To protect your kitten from contracting a preventable condition, it's critical to have them vaccinated. It's equally imperative to follow up your kitten's first vaccinations with regular booster shots during their lifetime, even if you expect Fluffy to be an indoor companion. The aptly named booster shots boost your cat's protection against a variety of feline diseases after the effects of the initial vaccine wear off. There are booster shots for different vaccines given on specific schedules. Your vet can provide advice on when you should bring your cat back for more booster shots. A vaccine is usually given by an injection under the skin, although sometimes may be given as drops into the eyes or nose. It is a preparation designed to provide protection against a specific infectious disease through stimulating an immune response that will protect the cat if it is subsequently exposed to the infection. All vaccines have to undergo rigorous safety and efficacy testing before they are licensed for use in cats by regulatory authorities. When used appropriately and as recommended, they are both safe and provide crucial protection for cats against a number of diseases. Some people are tempted to use homeopathic vaccines or may have these recommended by a friend. However, these should never be used. They have no scientific basis and cannot provoke the specific immune response that is needed to provide protection. Only use vaccines that are recommended by your vet. Diseases should vaccinate cats against. The availability of different vaccines will vary between different countries, because some diseases are not present everywhere and because vaccines are not necessarily licensed, and therefore available, in every country. The most commonly available vaccines are used to provide protection against the following infections: Feline Panleukopenia virus, FPV, feline infectious enteritis, feline parvovirus, feline herpes virus, FHV1, cat flu feline calicivirus, FCV, cat flu feline leukemia virus, FALV rabies, Chlamydia Felis, Bordetella bronchoseptica. Core and non-core vaccines. Vaccines can be divided into core vaccines and non-core vaccines. The core vaccines are considered essential for all cats, including indoor-only cats, because of the widespread and/or severe nature of the diseases being protected against. Non-core vaccines are only given to cats if there is a genuine risk of exposure to the infection and if vaccination would provide good protection. Decisions regarding the requirement for non-core vaccines may be based on the cat's age, lifestyle, and contact with other cats. You should always discuss with your vet what vaccines your own cat may require. Core vaccines. Feline Panleukopenia. Feline Panleukopenia virus is a severe and frequently fatal cause of hemorrhagic gastroenteritis. Outbreaks of infection with this virus are common and a high proportion of affected cats can die. Vaccination against this virus is highly effective and has a critical role in protecting cats against infection, especially as the virus is highly contagious. The virus can also survive for long periods in the environment, so vaccination is the only real way to protect cats. Feline herpes virus and feline calicivirus. Vaccines for feline herpes virus, FHV1, and feline calicivirus, FCV, are always combined, as these two viruses together are the main causes of upper respiratory tract infections in cats, cat flu. Affected cats typically show sneezing, nasal discharge, conjunctivitis, eye discharge, and mouth ulcers. Clinical signs vary from mild to extremely severe, and occasionally other complications may develop, including viral pneumonia. With FHV1, even after the initial signs subside, most cats will remain permanently infected with the virus and some go on to develop recurrent eye infections or other signs. The viruses are often transmitted by direct or close contact between cats, but they may also survive for short periods in the environment. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. Rabies. Rabies is an important disease, and although it is more common in dogs, and more commonly passed from dogs to humans than cats to humans, cats can be infected and can be a source of human infection. For these reasons, where rabies is present in a country or in a region, it is recommended that all cats should be vaccinated against this disease. Vaccination is very effective in preventing disease. Non-core vaccines. Other vaccines are regarded as non-core and used when vaccination would provide valuable protection for an individual cat. Feline leukemia virus, FALV. FALV is an important disease that can be spread through fighting, mutual grooming, and sharing of food and water bowls and litter trays. Kittens may also acquire infections from the queen before birth. FeLV is an important disease, causing a wide variety of problems in persistently infected cats, including immunosuppression, anemia, and lymphoma. Most persistently infected cats will die as a result of their infection. It is possible to perform blood tests to identify cats that are infected with this virus, and isolating such cats and preventing them from coming into contact with others is one way of preventing infection. A number of FeLV vaccines are also available and are effective in protecting cats. Generally, cats that go outside and may come across other cats of unknown status may be at risk of being exposed to FeLV, and vaccinating such cats may be very valuable. Chlamydia Felis. Chlamydia Felis is a type of bacteria that mainly causes conjunctivitis in cats. Young kittens in multicat households, e.g., breeding households, are most likely to be affected, and there may also be mild upper respiratory signs. Affected cats can be treated successfully with appropriate antibiotics, but vaccination may be helpful in some circumstances as part of a control program in an infected household. Feline immunodeficiency virus. Feline immunodeficiency virus, FIV, vaccination is available in some, but not all counties. This virus is quite common among cats, especially cats that go outdoors and are involved in fighting. Infection is mainly spread through cat bites. There are many different strains of the FIV virus, and it is not entirely clear as of yet how well the available vaccine protects against all these different strains, but studies suggest that it is able to provide a valuable degree of protection for cats at risk of exposure. A potential problem is that vaccinated cats will also test positive on the routine tests used to detect FIV infected cats, but newer diagnostic assays are becoming available that may overcome this problem. All kittens should receive their core vaccinations and any others that are agreed upon between you and your vet. The initial vaccine course is often started at 8 to 9 weeks of age, with a second injection 3 to 4 weeks later. It is now common also to recommend a third vaccination, especially for FPV, at 16 to 20 weeks of age to ensure the kitten is properly protected. A first booster vaccination should be given 12 months later to ensure a good level of continuing protection. However, after that, the frequency of booster vaccinations may be only every 1 to 3 years depending on the vaccine, disease, and risk with the individual cat. Cats that stay at a boarding cattery will generally require an annual vaccination, as this is a higher risk situation. Adverse effects from vaccines are very rare, especially in view of the millions of doses that are administered every year. The most common side effects are mild and include lethargy, inappetence, or tenderness at the injection site, usually lasting no longer than a few days. More marked side effects may include vomiting, diarrhea, lameness, fever, signs of respiratory tract infection, or lumps at the site of injection. The side effect that has received the most attention in recent years is fibrosarcoma. This is a type of malignant tumor that can develop at the site of vaccination. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.